Welcome, everyone. We're going to get started. My name is Mihei Zhang, and I'm the Community Advocacy Director at California Pan-Ethnic Health Network, CPEN. I am located in the Los Angeles office, and I will be your facilitator today for our Mobilizing for Health Equity training series for the Having Our Say Coalition. Before we get into the webinar, let's do a quick sound and visual check. If you can hear me and see the screen, please use the hands up icon. If you're having trouble with sound or seeing the screen, send a message to the Q&A chat box and someone will assist you. So if you can hear me and see the screen, please use the hands up icon. Great. Sounds like the audio is good. Okay, so let's go to the next slide. Okay, so thank you so much for everyone for joining the fourth webinar in the Mobilizing for Health Equity training series. The training series is open to all, but designed to support the work of the Having Our Say Coalition members. And this coalition is a statewide group comprised of over 30 organizations that work to ensure the voices of communities of color are heard as part of the healthcare policy discussions. The training series was designed with Having Our Say coalition members' input. Through this series, we hope to learn together and provide foundational knowledge and tools around health equity advocacy and policy work. We invite community-based organizations who are interested in learning about advocacy, whether media, social media, legislative, budget, administrative, direct action, or more, to join and share this webinar series. And even though we are talking about this training series, for the Having Our Say Coalition members, if you're not part of the Having Our Say Coalition and you're on this webinar today, that's great as well. So the goal of today's webinar is to provide an overview and example of how media and social media platforms can be used to advocate for health equity. Next slide. Okay, before we get into the meat of our webinar today, I'm going to provide a few housekeeping items. One is that we invite your comments and questions. Please look at the Q&A chat box on your screen. If you think of a question for the speaker at any point, just type it in there, and I will forward the question to our speaker, and we will hold the questions for the discussion portion at the end of our webinar. So when you have questions throughout the webinar, please send your questions in the Q&A chat box. Today's webinar is being recorded. We'll be able to share a link with you after the webinar is complete. We welcome you to revisit the content on your own, or you can share the recorded webinar with your colleagues or your friends. Please take a moment at the end of the webinar to complete a quick evaluation survey. We really, really value your feedback, and it helps us to improve our programming and our work and future webinar series that we might be coordinating. Next slide. Okay, so we have our wonderful speaker today, Shade. She is a strategic communication specialist and works with advocates to support and enhance their media and communication strategies to advance their policy goals. Shade holds a master's degree in public health from UC Berkeley with an emphasis on health and social behavior. So I'm actually going to have her introduce herself a little bit, and anything that I'm missing at the moment, she can share, but she is a strategic communication specialist at the Berkeley Media Studies Group, and many of you on this webinar probably y'all are familiar with Berkeley Media Studies Group and all of the wonderful work that they do. So we're very, very, very happy to have her. So I'm actually going to pass it over to Shade now. And Shade, if you can, feel free to share a little bit more about yourself, and you can jump into your presentation. Thank you.
Thank you. Thank you for having me. We're excited to continue to work with different coalitions and to continue to advance health equity through the work with media. So if we can go to my slide, I can also just tell you a little bit about me. I've been at Berkeley Media Studies Group for over a year, but my background is also in community health. I used to work at a community health center in San Francisco in the HIV services department. I think that's a little bit more about who I am. And I want to tell you too a little bit about Berkeley Media Studies Group. So we can go to the next slide. So I know that some of you may be familiar with our work, but just briefly, when I mentioned that a big component of what we do is we do research on the news and how the news cover public health and social justice issues, and we are really looking at seeing how the issues are being framed, who is speaking in the news, who is not speaking, what kinds of perspectives are coming up in the news, so that we can support advocates to use the news in a more effective way to advance health and health equity and social justice. And that's kind of like leading towards the second point, where what we do is we do media advocacy training. So today is one example, although it's an abbreviated version. We do all kinds of training for folks who are interested in using the media to advance policy. And we also do one-on-one consultation with smaller groups. And lastly, we do engage with journalists, and we do like to work with them side to side, because we know that journalists really want to do a good job, and they're doing great work, and we want to help them see how the way that they're reporting on health issues can sometimes support our goals, but can sometimes hurt our goals. So we're hoping and continue to provide that education for our journalists and working together to improve the way that these issues are covered in the news. So if we can go to the next slide, I want to touch on what we want to achieve today in this webinar. So we have a lot of content, but I think the main goals that we have for today are to really hone in our communications and our media engagement strategies into an overall strategy of the work that you are trying to do, so that all of your communications and your engagement with the media is rooted in that overall strategy, and it's supporting the work that you're trying to achieve. And then the second point is I want to give you some media tactics and some pointers that can be helpful in your work, so that you can use them. So I'm going to cover some of those in detail, and some of those a little bit more quickly. But we will be inserting resources and links on the chat, so you can take a closer look, and we'll be sending those out later too. So if we can go to the next one, I like to start with this one because we often get this question, is the news still relevant? Why do we still focus on the news? Isn't everything on social media, or why the news? Is it all fake news? So in any case, we think that the news are still very, very important and very relevant to the public debate around health and social issues. So our answer is always yes, the news still matters. So this picture that you're seeing here is a picture I took a couple of months ago on an advocacy day in Sacramento that I went to visit some of our legislators, and I was happy to see that in their office they had the Sacramento Bee, front and centered. And when we were meeting with other groups, with other staffers, they were preparing their news briefings. So we definitely know that the news are shaping the debate in many, many ways. So one of the ways that we know the news shape the debate is that they just set the public agenda. They really tell us what to think about, what issues are deemed important, and what to talk about with our colleagues. And when we share something on social media, we're sharing it from a news source usually, and it's just telling us what is important to be talked about. And so if you think about whether your issue is being covered in the news or not, that can give you an idea of where are the gaps in the public understanding of the issue that you're working on. The second thing that we know that the news does a lot is that not only it tells us what to think about, but it also tells us about how to think about things and how we think about what's the cause, what's the solution, and what else is going on. Especially for folks who don't know much about your issue, the news may give them a very distorted perspective on the issue that you're working on. And that's again an opportunity for us as public health advocates to insert ourselves, insert our perspectives, and insert the work that we are doing, so that has weight in the debate, and that hopefully influences decision making. And lastly, like this picture shows, is that it does reach opinion leaders, it does reach policymakers, and policymakers can see it as a barometer for what's in the public concern, and what's happening in their jurisdiction. So we really encourage all of you to continue to engage with the news as pressing as they are right now. We think it's really, really important, and to know where how things are being covered. So because we want to use it, we want to use the news to reach those opinion leaders and to tell them a different perspective of what they may be seeing. So if we go to the next slide, this is like our basic definition of media advocacy. And the way that we see media advocacy is using the media strategically to really support the work that we are already doing, and to really support or advance an agenda, or advance a policy initiative that we are trying to pursue within our organizing efforts. So we're looking at the media as a megaphone to talk to the person or the body or the group who is making those decisions, and to have that conversation publicly. So that's our goal with media advocacy, is to be really strategic. And I say that a lot because we often get people interested in knowing how to talk to the media, or knowing how to get media attention, and that's all good, but we need to be strategic and in the way that we engage, and thinking about what we want to achieve when we engage with the media. So the next slide has our layers of strategy, which is our sort of guiding tool for advocates to use as you think through your organizing, but also as you think about your media engagement. So we're going to share with you a handout that we have that describes a little bit more each of the layers of the strategy. But what I want to emphasize right now is that the first and most important layer is the overall strategy. So knowing what you want to do and how you're going to go about it is going to determine whether you're going to engage with the media, and what are you going to say, and who are going to be your messengers, and also when is it a good time to engage with the media, and how, and which outlets. So all of those things are important, but we really always send people back to the overall strategy. And whenever we get a question of like, oh, how do I post this on social media, our question is always going to be, well, what's your overall strategy? What are you trying to do? And that's going to determine your media engagement. So let's go over the overall strategy. That's the next slide. And I'm just going to go over real quick of the components of the overall strategy, and then I'll guide you through an example. So first of all, we need to define the problem that we want to address. And oftentimes we think of problems as like big problems like poverty, or sexual violence, or housing insecurity, all these things that are big problems. When we are doing our organizing, we encourage people to define the problem a little bit more narrowly, like what is missing right now, what do we need to do? And so it's very, very tied to the policy solution, so that we when we talk about a problem, we are priming our audiences about what kind of solution we are seeking. Um, so we need to be very clear on those two things. We need to identify who is a person, who is the or body or entity that has the power to make that change. In other words, to implement that solution and to say yes, we will do this. We will do this because that's knowing who our target is going to determine what kind of media we use. It's going to determine what kind of messages are going to be more effective. It's going to determine who is a better messenger. So knowing, and sometimes that takes time. That takes time to go figure out who are we talking to. But we need to be very intentional and very strategic in finding out that information so that our messages are very clear to them and we tell them what to do. And the next, sorry, not the next slide, but the next point here is enlisting our allies. And we know that a lot of you are doing a lot of equity work and racial justice and social justice type of work. And we know that working with allies and developing those relationships is going to be a key component of your organizing. We can't do this alone, and we need to support one another and to have any effective campaign. We need to bring those allies who are going to help us raise their voices. And then lastly, we need to identify what actions are we going to take to influence the target. So if we are trying to target a city council member, we can do one-on-one meetings, we can do letter writing, we can call, make phone calls or invite our allies to make phone calls. So there are many different actions, and not, some of them may involve the media, but not all of them. So we just need to have that very clear so that when we start thinking about our communications and our media, then we know what we're telling people to do, how we're telling them to do it, and how, that we are using the media strategically to do that. So I want to walk through an example and something that we've been working on a lot. It's on the public charge rule, and some of you may be familiar with what's going on with public charge, but some of you may not. So I'm just going to do a quick recap so that I can walk you through an example. The public charge test it's been used, and it has been used for a long time by the Department of Homeland Security and Immigration to determine whether a person is going to be admitted in the country or whether they're going to be granted legal status or citizenship. And the test is used to determine whether that person is going to be admitted based on the use of services, the prior use of services, or the likelihood of use of services. That has been going on for a long time, and that's we know that's a way for immigration to determine who is and worthy of coming into this country, and whether somebody is going to be using government sources to support themselves. So the proposed rule is looking to expand these types of services. So instead of being just a few services, it's going to include more, and include important health and nutrition and housing programs. And we're seeing it like one after another coming out right now. So it's really scary, and it is really it has really important health implications. And something else that I do want to say about that is that we have there's a lot of groups that have been working on immigration and that are have been doing a lot of great work. And we, as a public health organization, and we working with another group, we thought that bringing up the public health perspective was really important. So there are groups doing a lot of work and documenting the chilling effect, meaning how many people are not going to their doctor appointments or disenrolling from WIC and all their services just because they're afraid that it's going to damage their chances in the future. There's people who are communicating with community members to continue to tell them that you can still continue to use it. This is not active yet. And to fight back at every stage of the process. So there's been a lot of mobilizing around this, and I know I'm going very quickly about this and omitting a lot of things, but this is the context of the organizing that we did with Public Health Awaken. So that's the next slide, and I just want to go back to the overall strategy and walking through the example of that we did with Public Health Awakened last October, November, when we were trying to mobilize people to submit comment. So the way that we define the problem is that the public charge rule will harm health, and it's already impacting communities. The policy solutions that we wanted to push for was that the rule would be stopped. The target is the Department of Homeland Security. The allies were all of the immigrant coalitions and groups that have been working on this for a very long time, and also leveraging the public health coalitions that we at Public Health Awaken had developed. And then the very specific action that we wanted for this is to submit comment, because we knew that that was going to go directly to that was a window opportunity for people to oppose the rule. So this is kind of like walking through the overall strategy steps, and so I want to talk about a little bit about, how do we get people to submit comments? So within this bigger strategy, we nested a mini strategy to talk about, okay, so our solution and our goal is to have people submit comment. Then our target shifted a little bit from Homeland Security to public health practitioners. So we were targeting and organizing public health practitioners. And the actions, what we did and what we wanted them to do was to submit comment, obviously. So working on developing a portal that was easy to use so that people can comment, providing sample messages, providing data sources, doing one-on-one outreach at the American Public Health Association conference, doing flyering, sending out emails, all kinds of different activities. So as you can see, your overall strategy is going to determine your path, and then you can then determine when using the media is going to be an important piece of this. And sometimes it may not, and that's okay. We want to be strategic and not just getting media attention for media attention's sake. We want to be intentional in the ways that we use it. So if we decide that we want to use media and think about media, yeah, you can go ahead. Talking about the media strategy, this is also, again, a list of questions. And our tools are essentially a list of questions for you to think about what's the best strategy. So in terms of media, first of all, is to think about what's the best method to communicate with your target. Sometimes the media may not be the best method, and if you have access to that person and have a one-on-one meeting, that can be much more effective. And so people working in public health departments may not have the access to talking to the media, but they can do other forms of communication. So identifying that first is really important, and no reason to go to the media if those methods are effective. In the case of the public charge rule organizing, we knew that there was a strong listserv, so email was a very good way to communicate with our targets, which were the other public health workers. Then deciding if the media is going to advance, decide if and when it's important to bring attention to the public. Oftentimes we can use it to amplify the work that we're doing. We're having this conversation with our target, but we are using the media to bring attention and to hold them accountable. Then we have to think about what media will reach our target. So depending on who we are talking to, we are going to select the media. And if, remember the first picture I showed you, it's very likely that our legislators in Sacramento are going to be looking at the Sacramento Bee. But you know who is going to be the person in that your coalition or that your group is targeting. Then that's going to determine what media source is going to be more effective. And then lastly, the compiling media tactics that you can use. And I'll go over some of those. But first, I want to go to the next slide to tell you a little bit of some of the best practices that are kind of like basic media engagement suggestions that we think you need to be doing on an ongoing basis. The first of all is to to track coverage of your issue. We encourage all of you to engage with the news critically and look at who is covering your issue, how are they talking about it, what kind of who is who's speaking, who are they quoting, because that's going to help you identify who is doing a good job and who's not doing such a good job. And when they contact you, you may be able to say, you know what, I don't I don't want to talk to you, and that's totally fine. If you think that that the media is not going to do a good job, then you don't have to talk to them. But if they're doing a good job, you can contact them and you can tell them how good they are doing, how you can be a resource for them, and develop those relationships. And really working on develop relationships with reporters can go a long way when you are trying to get attention to an issue or an event that you're organizing. So reporters have piles and piles of emails that come in. So if they know you, or if you know they remember you, that you've been a trustworthy, reliable source, they'd be more likely to respond to you. So some ways to do that is to send them a note, or invite them out for coffee, invite them out to come to your organization, and reaching out to them can be a good way. And if you get to talk to them in person, then following up and providing more resources, that all of those things can go a long way in developing relationships with reporters. You can also provide resources to them, data sheets, and if they want to talk to to a staff person, obviously prepare your staff person first. But they always like to talk to someone. And so in the chat box, we sent a list of an example that we do at BMSG is we track some issues, and we send out a newsletter every day on issues relating to health equity, to sexual violence, to environment and health, and other important issues that we are keeping track of, and that helps us help us know what's being covered, how is it being covered. So we encourage you to sign up or do something very similar on your own. The last point here is to maintain a media calendar. We encourage people to have a media calendar and knowing what are important dates that are coming up, so that you can be proactive in pitching a story to a reporter when you know that there's going to be an anniversary coming up, or that there's a relevant date, an awareness day or something like that. That can be helpful for you to plan your media engagement activities. We just had a couple months ago, we've done a lot of work around gun violence, and most recently we had a reporter from NPR calling us at the Parkland anniversary. So obviously they are looking for those timelines, and they're looking for those important dates to have some sort of coverage. So the more proactive you can be in this way, then you'll be much more ready. So these are just basic media engagement best practices that we recommend that you do, and that you have this as an ongoing strategy for your organization, because this is going to prepare you to be ready when you are going to do a call for action, or when you're going to have an event. Then this is going to go a long way in getting coverage for you. So for the next slide, I have a few media tactics that we recommend to advocates to use. Letters to the editor, editorials and op-eds, and all those opinion pieces. In our research, we find that a lot of progressive voices are missing in these spaces. So we really encourage folks to use your voice and use the work that you're doing, and to bring attention to that and in these opinion spaces. I'll talk a little bit more about that in a second, but also want to talk about other media tactics that you can use. You can create news, and again, you can release a report, and those always get news attention. You can have an event and invite media to come cover your event. You can stage a protest, or do something else and create those news, so that they can come and cover your issue, and then give you the opportunity to talk about what you want to talk about. You can also piggyback on breaking news. So if something's happening nationally, you can talk about what what is happening at your local level and bring it to the attention. And again, if you have already established relationships with reporters, it's going to be more likely that they're going to come and talk to you about it, or that they think about you to talk about a big issue. We sometimes we put paid advertisement because some advocacy groups have used that. We know it's tight, the budgets are tight, and sometimes that's not an option for folks, but that's definitely something that's available to put your message out and to target your audience using that a paid advertisement where you can control the content absolutely. Um, and then lastly, in social media. So I'm going to talk about that later, but I want to put it in here within this media tactics because all of it has to be within your strategy, and all of it has to be, um, thought about as, as a whole, not as an independent activity. So let's talk about the letters to the editor. That's the next slide. And we are going to send you a template for writing a letter to the editor. It's a very simple template that we've developed and we've used with folks and workshops, and people write letters to the editor in like 15 minutes and they submit them, and some of them get published. So I really encourage people to write those. They're easy to write. They're short. They can be really concise and to the point on the letters to the editor. They're usually very reactive, and we know right now we don't have a shortage of things to react to. So for sure, it's a very useful tool to shift the narrative and to shift the perspective and to bring in public health equity to the public debate. It's a very, very easy way to elevate progressive perspectives, and it's also easy to share and reshare and promote the message that you are trying to put out. So this is just a very simple example where somebody who wrote a letter to encourage people to write comments. This is just the end of the letter, it's not the whole letter, but I just wanted to point that, somebody was like, a lot of people mobilized, and you can definitely include an action or an ask or a solution for in your letters. The next slide has a little bit more information on op-eds. They're both very similar, but op-eds and editorials, they require a little bit more planning. And they are longer format, so you need to do a little bit more research. You need to prepare a little bit more, which is fine because it gives you the opportunity to go a little bit deeper into the work that you are doing, the problem that you're presenting, and also the solution that you are presenting. We are also sharing in the chat box and lessons learned from a media advocate. So one of our former staff members here wrote a letter to the Sacramento Bee. An op-ed around immigration. So we wrote a blog with some tips and recommendations for writing op-eds. So if you want to take a look at that for preparing and writing your letter to your op-ed, sorry. And then tailor your pitch. What I mean by that is that you can, knowing what source you're going to send it to, you can talk to them and be more tailored to when talking to them about why they are the good publication or the right publication to take your pitch. And then I forgot the op-eds can be reactive as well, but they can also be very proactive. So if you have your media calendar and you know that there's something coming up that it's going to bring attention to your issue, you can have your op-ed ready to pitch when the time comes. So it can be both reactive and proactive. So this is just the short and sweet version of how to do this, but just wanted to give you some ideas. So in the next slide, we can some recommendations on how to submit opinion pieces is definitely to be timely and to, that's one of the newsworthiness biggest elements is that, it's happening now and it's very relevant. And then think about other elements of newsworthiness. We're sending also another another resource with a summary of some common elements of newsworthiness and examples. So what are reporters looking for, so that you know how to leverage those and use them in your pitch or use them in your letter to the editor. Um, we really encourage folks to include a solution. We know how depressing the news are, and most of the times that is because they don't include a solution. And we know, we who are working on these issues, we know there are solutions, and we want to advocate for those. So we really encourage all of you to be clear and concise when presenting a solution. Um, Follow the publication guidelines. That's a no-brainer. They'll usually have guidelines on how to submit to them, and if they don't, you can always email them and ask how can you submit. And lastly, be persistent. This is not, this takes time. This takes practice. So don't be discouraged if it doesn't get published at the first time. Just continue to, to be persistent and to continue to submit. It's going to give you more practice, and it's going to pay off. So those are some just quick recommendations on how to present these, how to pitch for opinion pieces. I want to move on to social media real quick. I want to do a review of our media strategy. So the same way that we think about news media, we want you all to think about social media. So is that the best way to communicate with your target? Is that going to advance your goals? Is social media going to advance your goals? Is social media going to reach your target? So if your targets are not on social media or not active, then maybe that's not a very good idea. And also compile the media or social media tactics that you will use. So again, depending on your overall strategy, you would realize whether you need to use social media or not, and how you're going to use it, for what purpose. Oftentimes, and in the example that of the public charge advocacy that we were doing, we used it to rally up allies. So we weren't really trying to reach DHS through social media, but we were using it to mobilize people and to activate people to submit comment. So again, like we had the media engagement best practices, we also have some social media best practices. So that's the next slide. And that's where, that's something that you need to be doing ongoing. Your social media campaigns and your social media engagement and advocacy is only going to be strong or as strong as your regular social media. So if your organization doesn't have a platform yet, then, thinking about which one you're going to select, and going back to the media strategy. Is it going to reach your targets? Who's going to be your audience, and which platform is the best one for you to use? We encourage you to dedicate time online. That's the best way to keep up with the changes, keep up with what other people are doing, to really, be engaged, to post regularly, engage with your audience. All of those things are going to make your social media presence stronger. So when it's time to mobilize allies, you have, all your networks are connected and engaged with you, that you are able to send those messages out, and that they get disseminated strongly. And then something in there, the monitoring, the metrics. That's, social media has those metrics: how many views, how many clicks, how many people shared it. All of those things can be useful for you to know what's working and what's not working. A lot of it is trial and error, and that's okay. But looking at those metrics can help you determine what's working with your audience, and what you need to do more of, or what you need to do less of. So again, this is ongoing. This is not for any specific campaign, but we do encourage, if you decide that social media is something that you and your organization want to do this now, and to do this on an ongoing basis. Social media moves really fast, and so if your last post was last year, then people are not going to be so engaged with your content. So just quickly for the next slide, for selecting a platform. Selecting a platform can be really overwhelming, like this image. There's so much information about which platform does what and reaches who, and only, again, going back to your overall strategy, you know which one will be the best depending who you are targeting. Are you targeting youth? Maybe the Snapchat will be a better platform. If you know, if you're sharing, you're doing a video campaign, or depending on what you're doing and depending what you're trying to do, you're going to decide which platform can be more useful. So we are also sharing more information of other resources to learn more about each if you haven't used it yet, and then decide which platform is going to be more useful for your goals. Um, so this, yeah, I don't want to go in detail of these, but that's something that's going to depend for every one of you, which one is going to be more effective. So going to the next slide, I have just some tactics. This is not extensive, but this is where you can get creative in using social media. If you're going to mobilize, if you want to have some sort of campaign, these are some tactics that you can use. Creating your hashtags that are easy, that people can remember them, and to talk about the work that you're doing. Providing sample messages. So that's something that we did with the public charge rule campaign, is providing those sample messages and creating the protect families or keep families together. All of those, providing them ahead of time so that they will be used by anybody who was posting about it, and obviously asking people to share during your posts or also in your offline organizing. Tagging reporters and elected officials again can be useful, and also depending, which page you're using, and if your page is active, if your page has followers, it's going to be much more effective than if it doesn't. Live tweeting meetings is something that we've been seeing a lot, where people can start commenting and reflecting on what's going on, perhaps at a hearing or a city council meeting. So that's one way to engage tweeters. Another one can be to stage a tweet storm. So if you know that there's a decision happening, or if you know that there's something coming up, you can, again, tap into your allies. This is offline, and say, this is, this allies that you've in relationships that you've already developed, and ask them to post, and you can again send them the hashtags, send them the sample messages. So there's a lot of work that goes behind any advocacy tactics on social media. The last one is, if you are trying to engage folks with your issue and the work that you're doing, you can host a tweet chat where you invite other people to talk about a specific issue, and invite use hashtags again to engage audiences. Again, this is not an extensive list, but it's just some pointers and some ideas of what things you can do. You can be very creative, and we've seen really cool stuff happening online, but also being mindful and being intentional in the way that you're using it to support your overall strategy. Okay, so we have a few more minutes, but I do want to say, okay, all of this is good, but if you want to get media attention, and then what you're going to say, and if you don't know what to say, then that's a wasted opportunity. So the message component is really, really key, and I didn't want to leave this out. So I'm going to go through it quickly, but I think it's really, really important. So the first piece of a message is thinking about how you're going to frame the issue. And in the case of the public charge rule, we wanted to frame it as a public health issue, so that the message had to, speak to that. Then we developed some messages for our allies to mobilize them, and then also messages for them to submit in the comments, and tailor to their, so that they would be unique comments. The messengers, who says it, who is a more effective message. And then in this example that we've been talking about, we really wanted to tap into the public health professionals. And the public health professionals, we were targeting them, but we really wanted them to become messengers and to talk about the public health implications from an authentic voice, from an authentic perspective. And then the target, thinking about who your target, who you want to hear those messages. Obviously, in this example, it's a very clear target because it is an established uh, form of communicating. It's a public comment on a proposed rule, so it's very clear who the target is. But if you're doing some other different type of advocacy, you need to have that very clear in your message strategy. So in the next slide, we have the components of a message, which is the um, the tried and true formula that we use at the MSG, and we recommend the people that we work with to include these three components in your messaging. So the clear statement of a problem, a value statement, a value solution, a value dimension, and then a policy solution. So, or the type of solution that you're seeking. Again, it can be big policy or small policy. But those two, the problem and the policy solution, have to be in alignment. And then really speaking about the values, and that's going into the next slide. We know from research that facts do not move people, that we don't get activated by facts. We act and we do things, and all of us do other work that we do because we care and because we want this to be a better place for us, for our community members, for our children. So we need to speak to that, and we need to evoke those shared values so that they resonate with our audience and that we connect with them at that level before we even talk about our policy details. That's important too, but we need to be better at articulating the values that we are fighting for. So I want to show you an example of a message that we developed for the public charge rule, Mobilizing. So you can see in the slide, I'm just going to read it. Our country is stronger when we invest in the nation's health. However, through a proposed expansion of the public charge regulation, the Trump administration wants to take away health care, housing, and food assistance from low-income immigrant families, including U.S. citizen children. It is time to join together to fight back against the Trump administration's proposed public charge regulation, the latest attack on immigrant families. 3 easy ways to protect families. 1, submit a comment. 2, get at least 3 others to submit a comment. And 3, share on social media. So this was our call for action for our public health allies. And in the next slide, I just want to highlight the components of a message. So there's the values, there's the problem, and there's a very clear solution. So what we want to encourage you to do is whenever, you can use this obviously in an email like this, but you can use it for, in your op-ed, in your letter to the editor, when you're talking to a reporter. Emphasize the values, be succinct about the problem, and really point people towards the solution. There's no ambiguity here about what you need to do. It's very, very clear. And that's what we want, because people come in and they with their own understandings of the world, and if you're not very concise and clear about your solution, it may not resonate with them. So being very clear on what you want people to do can be much, much more effective. And lastly, I just want to show some of the outcomes of this work. So we got a lot of comments from people around the country, and using the email call to action was most effective because there was an established listserv, but social media was really useful too. And what I wanted to say about this is just that there's a lot of work behind any media strategy. There's a lot of work that has to happen offline that you have to do ahead of time. That there's a lot of planning and organizing, and all of that is going to pay off when you are creating a campaign or when you're trying to talk to the media. This is, it was exciting to see so many people from all over the country to speak up about this. Moving on to the summary, and just want to finish up because I want to open it up to questions. I think it would be much more interesting to you also, and to hear what your thoughts and reactions are about this. Is I'm a visual person, so I just left the images, but most importantly, and the one thing that I want to make sure it's very resonates with you and stays with you is that you need to have an overall strategy before you're going to engage with the media. You need to have an overall strategy, knowing what you want to do, how you want to do it, and who you're going to work with is going to dictate whether you're going to use the news, whether you're going to use social media, and then which social media. All of that is going to be dictated by your organizing. And lastly, but not least, just remember to emphasize and to infuse your messages with values. That's what really is going to motivate people to take action, and so not to not undermine this piece. So with that, I want to just wrap it up so we can have a little bit more time for questions.
Great. Thank you so much. I've just been jotting down a lot of notes, and I think the, you know, media strategy just seems very elusive to me in a lot of ways. Um, and so this really helped, clarify some of the or demystify what the strategy should be used for. So thank you. We're going to give folks a few minutes to sort of process and digest the presentation and get people's questions so we can discuss.
Sure, I know it was a lot.
It's really good information, and I know people are curious and have a bunch of questions, so I'm just going to give folks a few more minutes to type in their questions. But in the meantime, I actually came up with one question for you. I was just curious if you can share like an example where, you set, the overall strategy for a particular issue, and that could be public charge or something else. Can you share an example where it really met its goal, and also an example where the strategy was a bit challenging, where like you feel like, okay, like I'm not really sure if it met its goal, or like there was a lot of challenges to that. So can you share a little bit on that?
Let's see. Um, I'll have to think about that. But it's something that I do want to say about that is that having a clear goal in terms, of what we want to achieve with our media, if we want to pressure someone or mobilize someone, that's going to determine how we're going to say it was successful or not. And sometimes sometimes it is, did it get published or did it not get published? And that's our measure of success. We know that, some of these other decision making processes, like if we're going to work with some, there's a lot of work going on around housing in the Bay Area, and we got a letter, an op-ed published, but then is that changing everything? Well, maybe not, but we think it is really having an impact on decision makers, and we are hoping that it is influencing policy. But the fact that it got published and that we got that we got a good image, that it was, because the editors will choose the images, they will, adjust the titles and things like that, and sometimes you may lose a little bit of control. But then if by knowing that they did it in a way that we felt good about, then that was, one measure of success. And I can send that op-ed that we work with a coalition in the Bay Area around housing.
That would be great. Any templates that you could share with the coalition members, that would be really helpful. And I think with that, like, do you all, have right now we live in such a media saturated environment. There's just Twitter posts everywhere, Instagram, and news. And how do you really like navigate elevating your message when we live in such a saturated world and people are bombarded with messaging and framing from all different sides?
Yeah, I think using the letters to the editor is a really good way and an easy way to insert those more progressive narratives in the public conversation, and at least so that people can see it. Because oftentimes we don't see that a lot, and then when we see, more conservative narratives, we may think that that's all there is, and we may think that that's the majority of people, and so using those spaces to insert our perspectives is a and
Mm.
it's a good way to do it. But then again, what we when we talk about using, selecting the media or navigating all of this, you know, big world of media, is really thinking about who are we trying to reach, and that's part of the overall strategy, and
Mhm.
what is the best media to get to that person or to that group, and so it really narrows down the options. So we are not going to pitch something to the New York Times if we are talking about a city issue in Oakland. so
Mm.
um so just being a little bit more strategic about it. And even though we would all love to have an op-ed published in the New York Times, that's not going to be relevant to the as relevant to the our target audience that we're working on.
Got it. That's really helpful. Thank you. So we have a question from the audience here. It says, what are some suggestions and advice you would give on mobilizing the communities around the topic that is something more general, like participating in the upcoming census?
Yes, I think for um, for mobilizing people for something more general, really appealing to values and really, really talking about why the census is important, and talking about representation, talking about democracy, talking about everybody having a voice and everybody being counted and everybody being represented. All of like appealing to those values can really help people activate. And obviously, there's some action, right? So participate. How? What do you want them to do? Um, so really being clear about what you want people to do, but again and again, we see that really talking is starting at the values level. We can really motivate people, and if you've seen it, when inspirational speakers, the values are the ones that really like make you know our goosebumps, and like gives us like this like really emotion to, yeah, we really want to do something about it. So I would start there.
Great. Okay, so we have just 3 more minutes left, and the last question I have for you today, and thank you so much for your time, that there are a few coalition members who are actually interested in doing a letters to editor, and so can you just sort of give us, you know, the beginning like 5 steps, if they want to do letters to editor, what are some of the things to consider?
Yeah, so letters to the editor are usually responding to an article or a news source news that's happened. So tying your issue, and that's why we call it piggybacking, where it may or may not be super related, but you can always talk about, like, you mentioned this in your article, and I want to, like, what people don't know is that there's this other thing happening. So really tying it
Mm-hmm.
to what your the original article was saying, to yours, and bringing connecting those dots for folks, using elements of newsworthiness, and again, like we sent in one of those resources that we put in the chat box. Why is this important? Why this reporters should care? And so often we ask, like, ask yourself, so what? Why do people need to know about this? So what? And that's because that's probably what's going to be going on in the reporters or the editors' um, mind when they're reading your article. Another big um, recommendation is to avoid jargon and technical terms, or even like catchphrase words or that we use within our networks, but they don't resonate with the public. So something like um, trauma informed care, that may resonate to a lot of us, but for the general public, that means absolutely nothing. So what we
Mm.
recommend folks is to use plain language that anybody can understand. Even though your target may understand it, you since you're having a public conversation, you want to make sure everybody's in the conversation. Um, so using plain language, leveraging newsworthiness elements, piggybacking on something, and really very, very importantly, presenting a solution because, you don't want to be vague. Who needs to do what? How is this going to be solved? And it's also like, giving clarity, but it's also being hopeful. Like there is a solution. We can do it. Here's how. And
Mhm.
that's really going to leverage all of the work that you're doing to, really present a solution.
That's great. That's really helpful and makes me want to do one myself.
Do it.
And I
Do
feel
it.
like I can, that I now have the tools to be able to go for it. So thank you so much. Um, so it is 12, and so we're going to go ahead and close the webinar. So thank you. Please take a
Thank you.
few moments to complete the short 2-minute evaluation. Thank you so much today. Thank you for everyone who joined us. Thanks to Saili, who's been handling the back end tech. And yeah, your feedback is really valuable to us. And the webinar recording and PowerPoint presentations and all the tools will be sent to you via email in the next week. So thank you and happy Thursday.